So good morning, everyone. Thank you for joining. My name is Anis Bimbrik. I'm the convener of this panel. I'm associate professor at the Hamad bin Khalifa University in Qatar. I'm very happy and delighted to be with you here. So let's start with the first paper, Adapting Evaluation Approaches for Conflict-Affected Settings. The paper by Yazan, Diane, Howard, and Mirvat. I think Mirvat will be presenting the first paper.
Thank you so much. Hi, everyone. Thank you for joining today. My name is Mervat Al-Haffar. I'm a research assistant at London School of Hygiene and Tropical Medicine. I'll be presenting on behalf of my team today. Evaluating health system in conflict-affected setting is very challenging, but it is also critical in order to spot or to look at the consequences of the violence and service disruptions on community. And the important thing is practical and the ethical challenges involved in implementing such research in conflict-affected settings. So our aims were first to examine the avenues and to overcome the common obstacles that people or researchers would encounter when evaluating health system. Second is to describe how our remote methodology has enabled our access to the hard to reach population in such communities, basically in Syria, because all our work we're doing were in Syria. Third, to propose ways to involve and engage Syrian communities of practice and communities of experiences in evaluating the health system while safeguarding the research participants. I would like to start with providing a very short background on the Syrian context. Of course, this is not going to give justice to what happened over the 10 years of conflict, but I will try my best. This protracted conflict has been going on for the last 10 years. However, it started by the violent government responses to the peaceful demonstrations, demanding human rights and political change. It resulted in over 500,000 of documented deaths, and half of the pre-conflict population have become either IDPs or refugees. Of course, it's important to mention the economic collapse that started since 2011, and now it's in its worst condition, with more than 80% of Syrian people inside the country under the poverty line. Speaking of the Syrian healthcare workers, an estimated of 70% of healthcare workers have left the country, and this migration has been induced by the systematic targeting, detention, torture, and other insecurities that health workers have been encountered during this conflict, and it's mostly by the Syrian government. The challenges of or the conditions that the healthcare workers are providing health services currently in Syria have been really challenging, and it changed between the areas of control. So basically, we have the shortage of electricity, the fuel, lack of equipment and medication, along with the very long working hours and because of the lack of personnel. We can be confident about dividing or roughly dividing the country into 4 areas of military control. First, we have the opposition-controlled areas in the northwest. We have autonomous administration control in the northeast, and in between we have an area like areas of Turkish forces control. Lastly, we have the Syrian government control in the center of the country and in the south. Of course, each area has its own health system, its own governing body, and its own challenge. And it's really important when doing health system evaluation in Syria to consider this the different military control and the governing body. Of course, the coordination between those areas is lacking, and there is always armed clash between the factions. And of course, with like recently, the Syrian government have resumed the shelling on the northwest of Syria in Idlib. I will be presenting today like two papers of our work. First, the scoping review of that we did recently, the scoping review of published literature between 2000 and 2021 on health system evaluation research in conflict-affected settings. And we identified 69 eligible articles. Most of them have used the qualitative methods. The second paper is about, it's more like an insight of our work of remote health system research. Since 2016, we've been working on this, and we thought that it would be helpful to provide the insights or some kind of tips or criteria of doing remote research in conflict-affected setting. And of course, we used qualitative research because it is particularly helpful to account for the lived experiences of conflict and to inform the health intervention. I will talk about the findings from the scoping review that we did. First, most of the studies assessed service provisions, highlighting the detrimental effects of the conflict, insecurities, and the deliberate attack on health system, infrastructure, and personnel. Also, most of the studies focus on describing the problems rather than providing mitigations or solutions. Many studies describe the health workforce issues, highlighting the challenges that they face and of the out-migration and the overrun personnel. Also, half of the articles also assess the aspect of health governance and highlighting the collaboration between government and non-governmental actors, such as NGOs and UN. And also highlighting the fact that, like most of the time, the governance is fragmented and different bodies are contesting on the governance of health system, such seen in DRC and Syria. The other finding I would like to present here is a very kind of very short finding of our methodology published paper, and which I really highly recommend you checking it out. We managed to provide like 5 criteria of assessing whether remote methodology would be helpful to evaluate health system in conflict-affected setting. And we encourage researchers to do that before considering doing a remote research in conflict-affected setting. First, if we need to check if the remote methodology is suitable to answer the question and the evaluation question, and if there's other supplementary methods should be used. Second, if the remote methodology are suitable to reach the target population the target participants, we need to consider the internet access, the smartphone, and how comfortable potential participants are using them. And we might exclude a category of those participants. We need also to identify those. Also, we need to check if the financial and the time constraint can be mitigated using the remote methods, though cost cutting should be the only reason to using remote methodology. Fourth, if the remote methods adhere to the ethics and the research standards, which is really important, especially in our work in Syria. For example, seeking in-country ethics approval from illegitimate governments or dangerous governments could risk the participants' security. Lastly, how will the remote methods affect the community engagement, which is highly important in evaluating health system in conflict-affected setting, and what are the methods to make the engagement in repressed areas with limited freedom of expression. This is the paper that we published recently, and as I said, I highly recommend you checking it out. The other thing I would like to touch base here on is the community engagement in evaluating health system in conflict-affected setting, which is highly important, but also challenging, as we mentioned before. We talked about the community of practice and the ways of engaging community of practice, and we suggested having research advisory groups, which is recently have gained such momentum when doing and designing research studies. So the initial phase of any studies is really important to set the tone, and having research advisory group will help at the very beginning of designing the research studies and formulating the research questions. The committees would help in providing the contextual guidance and perspectives, and also providing some ethical consideration when doing such research in fragile setting. The second thing I would like to mention here is how to engage the community of experience, and we managed to do that in our team by following or engaging two kinds of population, like for example the diaspora, recruiting researchers from the diaspora, Syrian diaspora, who grew up in Syria, provided healthcare during the conflict. This helped us to increase the access and build rapport with participants inside the country. Also leveraging the personal and professional network of the Syrian diaspora researcher also helped with reaching more participants inside the country. The research topic, ensuring that the research topic are culturally appropriate and conflict sensitive, which help also engaging positively with the country itself and reduce the historic exploitation and inequities by building those bridges. The other thing also we managed actually to do in our research studies is engaging with in-country investigators. And of course, as you may know, how the conflict dynamic is always changing, and the situation on the ground is not constant. So we need investigators inside the country to provide the knowledge and the realities on the ground. So we managed also to engage with them and invite them to be also other researchers in our studies, and this helped us to understand more and the reality on the ground. To conclude, evaluating health system is in conflict-affected setting is really challenging, and it requires different methodology to assess the changing context and the health infrastructures. And we need to know that those are fragmented governance in conflict-affected setting. So this might be ignored by national level evaluations. So really, we need to consider these kind of conditions when doing the evaluation. The ground-up approaches we adopted to assess healthcare in conflict-affected setting, it's helped us to inform the assessment and adaptation, and also provide health interventions to enhance the health system response. The most important thing actually, and the dominant objective of our work in Syria, is to amplify the first-hand lived experience and marginalized voices. And we argue this is a very complex and delicate process of which we always reflect on, and we try to answer those questions. How do we identify the voices to be amplified? How does non-exploitive amplification process would look like? And it's really an ongoing process, and we're still trying to answer those questions. Lastly, we always reflect on our efforts also to frame the logistics, politics, and ethical consideration when evaluating the system through a decolonial lens, focusing particularly on the roles of the diaspora researchers. And it's really important to know the inherent privileges when doing such reflections, and consider the opportunities and tensions to develop our methodology in the future. That was all for me for today. Thank you for listening, and I'm happy to answer any questions.
Thank you very much, Mervit. If you have any question for Mervit, please raise your hand or use the chat box below. Yes, Jennifer?
Hi, Mervit. Thank you so much for your presentation. It's really, really interesting. I have a question about research ethics and ethics approval process, because I have been working with a Syrian NGO that's based in Turkey, but that works in Syria itself and the surrounding countries where you have Syrian refugees. And I've been advising them a little bit on research matters. And one question they had at one point was, we need a research ethics approval process of some sort, but how do we go about this? And which, do we develop one? Are there existing ones that we can use? And they came to me with that question and I really struggled. And I tried to help them a little bit. Like I found some literature on how to develop one yourself. But then obviously this is quite a big endeavor. So I was wondering, how do you deal? I mean, maybe because you're based in the UK and in other countries outside of the region, maybe you just use the ones in your countries, or are there any local ones? Are there any Syrian ones that can be used? From my discussions with the NGO, I think there weren't any, but you're the expert, please. If you have any advice, it would be much appreciated.
Yeah, thank you. Thank you for the question. It's a very important one, and it's been along a very long discussions about this. So basically what we did actually, so we work in opposition controlled area and also in regime controlled area or Syrian government controlled areas. In the government controlled areas, there's only one ethics committee that is based in Damascus, and it doesn't, it's not legitimate when you wanna do research or conduct research in northwest or northeast of Syria, obviously. So basically, we didn't go that route because we start it doesn't make any sense and it's gonna put participant under risk. We first, of course, we seek the ethical approval from London School of Hygiene and Tropical Medicine and the National University of Singapore, because those are the university we work at. However, in opposition controlled area, as I mentioned about the research advisory group, it was really helpful to provide insight on the ethical consideration. They are not ethics committees, of course, but if you engage them at the very beginning of the research design, it will help you to gain those insights, especially for someone who maybe not from Syria and hasn't worked there and needs more contextual advice on how those things would work out. I think in Turkey there's a local ethical approval if you want to work with the Syrian population in Turkey. I think from my information, I think that is the case there. Of course, hopefully, we've been talking about creating an ethics committee that could be represented or representative of the whole Syria and try to seek ethical approval from them. But this is a very long-term, I think, aim, and I think we hope to do that, but this is the case, and this is how we've been working around this issue. I hope that I answered your question.
You did, yeah. No, this is really fascinating, and it very much reminds me of the discussions that I had with my colleague from Syria. Would you be happy for me to put you in touch with him?
Yeah, of
because
course.
Because I know he's still interested in the topic, and I mean, if you have plans to work in this area, I think you would be very interested. Is it okay for me to email you?
Yeah, of course. Thank you so much for that.
Amazing. Thank you, Mervit.
Thank you, Jennifer. I think we have a last question from Neha.
Sorry, no, that wasn't a question. I was just appreciating Jennifer's question.
Okay.
Marwat, fantastic presentation.
Thank you so much.
Thank you, Mervit, for the presentation and for submitting your chapter for my book, the Oxford Handbook for Social Program Evaluation. Thank you very much again, and happy to have you here and to have you in my book. Now, let's go to the next speaker, Jennifer Philippa Eggert, with her paper, Meal, Faith and Development During the COVID Pandemic, Insights from Africa, Asia, and the Caribbean. So Jennifer, please introduce yourself, and you have 20 minutes presentation, followed by 5 questions.
Amazing. Thank you so much, Anis. So hi, everyone. It's so good to be here. My name is Jennifer Philippa Eggert. I work for the Joint Learning Initiative on Faith and Local Communities, the JLI for short. I have a presentation, so I'll start sharing my screen now. And then I talk you through that presentation. Let's see, where are we? Can you see my screen?
Yes, we see it.
Okay, fantastic. So I will be speaking about monitoring, evaluation, accountability, and learning, or MEAL for short, with a focus on faith. And then I will be looking more specifically at how faith-based organizations that work in Africa, Asia, and the Caribbean have been doing MEAL during the COVID-19 pandemic. I'd say a little bit about the rationale for this research, about context, tell you a little bit about the methodology, and then I have findings and a brief discussion for you. So in terms of the rationale, why did we want to do this research, and why should anyone be interested in this kind of research? We do know a little about development in faith and the role that faith actors play in development, even though development systems, international development systems, have long been very secular, and faith was often regarded as something that was irrelevant at best, or a bit suspicious at worst. But in the last 20 years, this has started to change. We know more about it now. There's a growing body of evidence. One area in development and faith that we still know very little about is monitoring, evaluation, accountability, and learning. And more specifically, how do we do MEAL when we work with faith actors? As part of this research, we were particularly interested in partnerships between local faith actors on the one hand, and international actors, either secular or faith-based on the other. We do know from our work as practitioners and researchers that some of the challenges of doing MEAL with faith actors in general, and particularly with local faith actors, is that MEAL can often be perceived like a burden, as a burden on local faith actors, something that is an add-on that is required by donors. Local faith actors can often lack capacities in this area. And then there is also often an issue around terminologies, methodologies, and priorities. So local faith actors, they often use different language. They often value relationships more than formalized outcomes and processes. So there's often a bit of a tension between what local faith actors want and what international donors, international partners need. At the same time, maybe there's also opportunities, maybe by acknowledging these tensions, being aware of them and trying to address them, maybe there's an opportunity of learning for both local faith actors and international partners. So that was the situation pre-pandemic, but then obviously COVID happened and everything changed. We at the JLI, let me give you a little bit of background about the JLI, an international collaboration of researchers and practitioners from both from faith-based and secular backgrounds. Our aim is to develop and communicate evidence about the roles and contributions of faith actors in development, humanitarian action, and peace building. We are a network of 800 partners, and we work a lot with so-called learning hubs, which are groups of our members that focus on one specific topic as it relates to faith. And one of these learning hubs is the MEAL Learning Hub, we published a compendium of good practices in meal and faith. So good practices in doing meal with local faith partners at the beginning of the year. And this research that I'm going to speak about today emerged as part of this meal learning hub. And the hub was set up in autumn 2019. We started planning the compendium in the beginning of 2020, and then again COVID happened and changed everything. But we decided to continue with the research. We called for case study submissions, first from the hub members. There's around 70 members of the hub at the moment. At the time, it was maybe 30. So we invited them to submit a case study outlining how they do meal in partnerships with their local faith partners, or some of them are local faith actors themselves. So in that case, we asked them to reflect on their relation with international partners. In addition to these case study submissions, we also conducted over 30 semi-structured interviews. We conducted interviews for context, and we conducted interviews with the aim of generating stories for change to include in the compendium. You can see here from the last 2 bullet points, we spoke with a very wide range of different organizations, different faith backgrounds, secular organizations, and literally from all across the globe. I think the only continent that's missing here is Australia. Now, we did use this data to write up the compendium. The compendium includes a general discussion of challenges and opportunities of doing meal with local faith partners. And then in a second part of the compendium, we have included 10 stories of change of 10 different faith-based organizations and their challenges and learnings from doing meal. I have here in this presentation, I thought I'll highlight the experiences of 2 organizations. One of them is Hope International, and then the other one is International Care Ministries, ICM, which I have on the next slide. I chose these out of the pool of the 10 others because they specifically reflected on how COVID changed their meal approaches. Now, Hope International is a Christian-based development organization. Their meal work has focused on, they work all over the world, but the meal work that I'm going to speak about now took place in Burundi, Haiti, Malawi, Rwanda, Zambia, and Zimbabwe. Hope mostly offer training, which is based on the interpretation of the Bible. They offer church-based saving services and microfinance. And in 2015, so long before the pandemic, they developed a volunteer engagement survey to find out more about how the people that they work with locally, how they viewed this sort of work. Really interesting. Hope, see, and this is where the faith aspect comes out really strongly. They see their monitoring, they don't speak just about monitoring and evaluation, they speak about listening, monitoring, and evaluation. And they actually see this listening as part of the ministry, so as part of their faith practices, and not just an evaluation of it. Now, COVID came, changed a lot of things. The 2 main things that changed during COVID was that priorities for the organization changed. So what they had been working on before may not always have been top priority during the pandemic. And then secondly, obviously, there were access issues. So when previously it was relatively easy to travel to local communities and do meal work, this was much harder, obviously, during the pandemic. How did they respond to this? Well, they first stopped all of their M&E work to really evaluate the situation, to assess the situation, and then they revised their M&E tools together with the local communities. And actually, while they had always been working closely with local networks, and especially their church networks, they worked with them even closer during the pandemic, because obviously the people were on the ground, Hope just stopped bringing in externals and worked more closely with people who were already in the communities, which is obviously something that we also know from outside faith networks. So there's been a lot of renewed talk about localization in the last 1 year and a half, hasn't it? How does it change the work? Hope felt that their relationships with the local communities were strengthened, and interestingly, they felt that they also received the data more quickly, just because there was a more direct link with the communities and a more simplified process of collecting this data. So this was Hope's experience from the Caribbean, in Africa. The other case study I wanted to discuss with you is from the Philippines, and it's the, again, Christian faith-based organization, International Care Ministries, or ICM for short, who are based in the Philippines. Headquarters are in Hong Kong. So we're moving from Africa and the Caribbean to Asia now. They also work a lot with church-based saving groups, very similar to Hope International. Also offer training for local communities, actually community-led training. So there has already been like a very, very strong focus on church and community work. Pre-COVID, they used to conduct annual surveys of 40,000 households. So quite an impressive number. ICM have a dedicated research and M&E department. So they're really, of all the faith-based organizations, I know they're really one of those that take their meal work particularly serious. Like Hope, when the pandemic started, they were also faced with a change of priorities and access issues. Very similar to what I spoke about when we were looking at Hope. It was much harder to travel to the communities. There were also, while ICM traditionally has been focusing on development work, now all of a sudden they were faced with humanitarian issues. They were worried about food shortages and were thinking about how they would be able to respond to that if things really were to escalate. They adapted their M&E work and developed a Sentinel project, a representative one. They're quite strong on quantitative methods, which is rather unusual for lots of other faith-based organizations, but they have a very, very strong quantitative focus. So they developed the Sentinel project, selecting church leaders from the communities. And they did these. They reached out to them via phone, so they would actually do weekly phone calls over a period of 6 months with them. And the reason they chose the church leaders, really interesting, was that, and again, this is similar to Hope. They realized that while everyone else who was not local to the community had pulled out, while most community groups and community gatherings had been stopped, church communities were still meeting, respecting social distancing as much as possible, but there were still meetings, and church leaders, they were still in touch with their communities. So this was one of the most accessible source of data at the time. They also felt that relationships were strengthened. They felt that church leaders actually were more strongly motivated during the pandemic, which led to better data. So people were, they were more motivated to speak with the ICM staff members on a regular basis. They were more candid about the situation in their communities, just because my colleague from ICM told me that in the past, sometimes meal was considered, and I mentioned it in the beginning, it was considered as a bit of a burden, it's not very relevant, right? But then during the pandemic, they actually realized that no, there is actually real value in monitoring and evaluating our work. And it's not just about collecting useless data that no one is ever going to benefit from, but this is actually a direct link from the communities to some of these organizations that work with the communities, but may not be based within the communities. So that's the 2 case studies. Now, I was thinking about what does that tell us more generally, more widely, and beyond the case of these 2 organizations. Well, first of all, I found it really interesting to see that when these organizations were presented with a change of context, with a change of priorities, they showed quite high levels of adaptability. They literally changed their approaches within a couple of weeks. Access issues, access was a major issue during the early weeks and months of the pandemics. And as I mentioned earlier, it was mostly face groups that were still able to reach out to communities, who were still aware of what was happening in the communities, and who, because they're organized, were also able to then feed this data back to external organizations. And they were able to do that because they had really strong relationships with the local communities. They were part of these communities and really deeply embedded them. And faith did play a role there as well, because it helped with trust, and people considered each other as a community of believers rather than as externals coming in. Stronger motivation during the crisis, I already mentioned that. It was quite an interesting learning point for the organization to see that even something like meal that may often be considered as a tick box exercise, as a burden by some of the locals, can actually benefit from a crisis like this. So this is this. I mean, we've heard this too much in the last 1.5 years, that there's opportunities in a crisis and all of that, and can come across as a bit cynical sometimes. But maybe for the meal practitioners that I was speaking with as part of this research, maybe for them it really was a moment like that, and they really had an opportunity to rethink their work with the face groups and reach higher levels of collaboration and deeper level of collaborations. And I guess the key question then is, will we continue to allow for this sort of flexibility and for approaches that are adapted to what the local community needs, even if it is faith-based groups that we look at, which, as I mentioned at the very beginning of the presentation, a lot of international and national development actors often view a bit suspiciously, because who are they, and what is really their motivation and their agenda, and do they not really have a hidden agenda other than their development work? And that's it for now.
Thank you very much, Jennifer. If you have any question, please raise your hand or use the chat box. Any question for Jennifer?
Can I ask a question, Anis?
Absolutely.
I would be interested if people are, because I'm assuming that people in the call have an interest in MEAL, right? In evaluation. I would be interested what your experience is with doing MEAL with faith actors. Do you know about that? Are you interested in that? Is this part of the debates that you have as evaluation experts?
No, you mean specifically for this panel discussion? Specifically for this panel?
In general. No, in general, as evaluation experts, because I'm I'm not an evaluation expert. I'm not a meal expert. I'm a researcher. And I have the background. I have the development background. I have the development and faith background. But meal was something new for us when we started working on this. So yeah, and we have been disseminating this research with development practitioners, with meal practitioners, with faith networks. As I said, I'm assuming that I'm in the room with evaluation experts. So I would love to hear from you. What are your thoughts? Like, how do you feel that there's an awareness in evaluation circles about the challenges and opportunities of working with faith groups? Is this something that you feel is not really on the agenda? Is there an openness, an interest?
Absolutely not. I mean, personally, I'm interested to learn more about meal. As I mentioned previously for Mervet, I'm editing a book now, the Oxford Handbook for Social Program Evaluation. And I think I sent you an email a few months ago with a call for chapter. I'm not sure if you managed to submit an abstract, if you're interested to submit a chapter for the book. Here in Qatar, I'm the founding director of a social program and evaluation research focused on the global south, including the Middle East. And we are interested, very interested personally, to create a global network for experts, evaluation expert or researcher involved in social program or meal or evaluation in conflict zone or any other context in the global south. So I'm very interested to learn more about your research. And please, you have my email. And again, if you're interested to submit a chapter, the deadline for submitting the abstract has expired, but I can extend it for you if you're interested. I think it would be nice to have your chapter in such important book. And yes, let's keep in touch and see how we can collaborate.
Amazing. That sounds great. Yeah, I'm still interested in submitting the chapter. I just didn't get a chance to finish it in time. But I'll email you about it. Yeah, I'll email you about it. And if I could get a new deadline, that would be amazing.
Thank you, Jennifer. Thanks a lot. Now let's move to the third paper. The paper from Dr. Harrison, IDO, COVID-19 and evaluation of the state of conflict-induced internally displaced persons in northeastern Borno state of Nigeria. Harrison?
Hi, good morning, Doc, and good morning, everyone. I hope you can hear me.
Good morning, we hear you.
Okay, so my name is Harrison Ido. Let me quickly share my screen, if that's not yes. Do this, okay. Share this one. Good. Can you see my screen now, please? Can you see my screen, please?
Yes.
Okay. So I'm Harrison Ido. I'm from a PhD student from the Obafemi Awolowo University here in Nigeria, and also I double as an assistant lecturer at a state university here in Nigeria also. I must say it's a pleasure to be here this day to present my research. Okay, this research is on COVID-19 and the evaluation of the state of conflict-induced internally displaced persons in northeastern Borno state of Nigeria. Just as a way of introduction, I'd just like us to take a pictorial view of how we might not know in person how it's like, but in picture, we can see the state of these people. This is how they live. We can see right here their tents, their living tents. We are told that each tent accommodates about 6 persons in this tent. And this is outside where they are gathered. Maybe they are outside of the tent. This is where they gather during the day, maybe to share when people come to distribute items for them. This is how they look. So that's just a brief on that, just to let us know how the situation is like. So my discussion will be focused around the background of this study, then the research method findings, and then we'll draw a conclusion. We know that there's no gainsaying about the fact that COVID has impacted very negatively. It has a lot of various negative impact on the life and health of people all over the world. But we're also aware that this effect could be felt disproportionately, especially among vulnerable populations, of which the conflict-induced internally displaced persons are part of this vulnerable population. We understand that there's a gap in literature because we noticed that attention is often being focused on the evaluation of the effects of the pandemic on other populations, whereas vulnerable populations such as the IDPs are often neglected from these evaluations. So this paper fills this gap by attempting to evaluate the state of IDPs in the face of the pandemic, coupled with the restrictions that were occasioned by the pandemic, and of course the challenges thereof, the challenges of conducting such an evaluation amidst the pandemic is what this research also set out to achieve. This research is important because of the global population of conflict-induced IDPs, which presents a source of concern for this group, for the internally displaced persons. While there are estimated 50 million, for instance, 50.8 million IDPs globally as at the end of 2019. Of this figure, we have 45.7 million who have been displaced as a result of one violent conflict or the other. So it means, therefore, that amongst internally displaced persons, we have a larger proportion, significantly large proportion, who are displaced as a result of violence, including the population that this study is meant to study. Now, Africa accounts for the largest figure of this population, while Nigeria accounts for about 2.6 million. That is the sixth largest conflict-induced IDPs population in the world, is what Nigeria holds. Now, Borno State, the field of this study itself is particularly interesting for this study because for one reason, that state is the epicenter of Boko Haram conflict. The Boko Haram terrorism activities is actually much more prevalent in Borno State. In fact, that is their headquarters. So, and thus, it has been the worst hit in terms of the number of conflict-induced IDPs, accommodating the highest number of these over 1.4 million conflict-induced IDPs is spread across 32 IDP camps in the state. So incidentally, also secondly, why we are focusing, or we decided to focus on Borno State is because as at the time of conducting this research, sometimes around August, September 2020, that was right in the midst of the pandemic, where restrictions were still in place, where a lot of precautions were still very much in place. Borno State accounted for the highest number of COVID-19 cases in the northeastern part of the country as at that time. Even more recent data on COVID cases in the country also puts the state as the third most hit state in the northeastern zone of the country. So these two prominent reasons made us focus on Borno State. Is one of the worst hit in terms of COVID in the northeastern state, and then it's the epicenter of Boko Haram conflicts as we speak. So that's why the study took that note. Now, the risk of COVID-19 transmission is higher in high population density and camp conditions where forcibly displaced IDPs find themselves. The kind of situation the IDPs in Borno State, Nigeria find themselves, we have been told, the OECD has told us that is the kind of situation that breeds the transmission or the high risk of transmitting COVID-19, not just COVID-19, but any kind of pandemic. In such circumstances, social and physical distancing which is the most effective public health intervention to contain the spread of COVID and any pandemic for that matter, may either be physically infeasible or else unlikely to be meticulously adhered to. Hence, the submission that inadequate preparation for vulnerable population like the IDPs during emergency period as COVID-19 presents can lead to catastrophic consequences. These are some of the reasons why this study decided to take out this special population of people to study, which is the IDP, because their case in terms of during pandemic is a special case, and so means deserves special attention. For this study, we decided to use an exploratory research design from document analysis, from interviews, recorded tapes, notepads, and etc. It took a qualitative research method, and then the study population were drawn from conflict-induced IDP camp officials working with federal and state government agencies and domestic and international non-governmental organizations. So we just focused on those who are always based in these IDP camps, attending to their special needs, attending to their health and social needs, giving them care on a daily basis. Some of them work with the federal government, some of them work with the state government, some are also working for international organizations and domestic non-governmental organizations. So we drew the sample population from these sets of people. The research instrument adopted is a semi-structured interview. The sampling technique is we use the purposive sampling technique, drawing about 13 key informant interviewees from among the population I just mentioned. And then we interviewed 13 of them from various organizations. Some of the organizations we interviewed are the International Committee of Red Cross. We interviewed the NEMA, the National Emergency Management Agency of Nigeria. We also interviewed some state agencies like SEMA, the State Emergency Management Agency. We also spoke to some other prominent international non-governmental organizations who are in charge of these camps on a day-to-day basis. And data we collected, we subjected to thematic analysis. What our findings we find that the living conditions in the IDP camps, given that states of the way they live, you know, the picture we show from the beginning of the presentation is a perfect description of how the IDP camp looked. We are told during the interviews with these officials that social distancing is really difficult given that situation, because they have shortage of tents. So there was no room to reduce the number of persons that live per tent. The same number of people who lived in each tent pre-COVID kept living in the tent. The only time they preach or they emphasize social distancing perhaps is when the IDPs come outside for maybe when it's time for delivery of goods, the time for distribution of things to them. That is the only time that social distancing was really emphasized in the camps. Otherwise, the IDPs still lived, they were still jam-packed inside those little tents that we saw earlier on. So, given the living condition in the IDP camp, we found that social distancing was difficult to practice among IDPs in Borno State. We also found that special measures were being put in place to protect the IDPs. For instance, if you are coming into the camp to visit the camp as an NGO, as a philanthropist, you come in to distribute things to them, you must be fully masked. You must not go close to them, to the IDPs. You must just make your distribution to the camp officials who are then further distributed to the IDPs. And now the IDPs were constricted within the camp alone. They were restricted to ensure that they don't leave. So there was no going out of the camp or coming in. Usually we were told that these IDPs, some of them had one business or the other they used to run, maybe the couple shoes, shoe cobbling. Some of them sell little trades and all of that. But during this period, they were all restricted and confined within the camp environment. They were not allowed to go out. They were all restricted within the camp. So hand washing equipment, taps or emergency taps were created around the camps, and hand washing soaps were all distributed around some very strategic points in the camp to ensure that IDPs were safe. Like I mentioned before, when people are coming to distribute stuff to the IDPs, they do them in batches. Before the COVID, it don't matter, everybody come outside and everybody collect what they want to collect. But during COVID, they ensure that these people were coming out in batches to collect whatever distribution was available for them. So those were some of the special measures that were put in place to protect the IDPs from contracting the virus. The lockdown occasioned by the COVID had adverse effect on the welfare of IDPs. That was another thing we found, that the movement, the restriction in movement actually impacted the IDPs. Like I mentioned earlier, some of them had little businesses that they were doing before the COVID, that maybe farming, some little sales and thereabout. But during COVID, they were all restricted from doing this, and so that impacted on their welfare, because some of them were no longer able to fend for themselves as they ought to. And then the pandemic also brought new health and safety challenges in the camp, but not security challenges. Now, there were new health and safety challenges because now there usually will be instances where these IDPs will fall sick. They said there used to be some chemists around where they can go and get drug and treat themselves. And they usually have the special nurses or special doctors around who attend to them. But during COVID, all of these services were no longer available, and so that posed another new health and safety challenge for the IDPs, such that when they fall sick or fall ill critically, they have to be moved outside of the camp to the hospitals outside of the camp. And we are told that those hospitals were usually very expensive. They are not quite affordable as those ones that used to be in the camp before COVID. So and most of them couldn't afford those costs, and that posed another health challenge to most of the IDPs. Now, it didn't pose any security challenge. We were thinking that now, before the COVID, actually there were some off cases, where those Boko Haram insurgents will take advantage and they'll go and attack those camps, even though they've displaced them from their homes. At one point or the other, before the COVID, we hear news about Boko Haram going to some of those camps to take advantage of the camp and cause nuisance there. But we understand that during the COVID, maybe because of the restrictions in movement, maybe because of all of the COVID restriction, there was nothing of such. So there was no security challenge, no Boko Haram attack or any insecurity challenge among the IDPs during the COVID period. On the implications for evaluation studies, evaluation could not be done in person given the restrictions of COVID. Yes, some of these findings could just be best as we heard from experts who were there. It would have been best done going to the field, going there to see for oneself. If we were able to move, if there were no restrictions in movement, there were no restrictions and special protocols because of COVID, this evaluation would have been more robust if we were able to be in those camps, seeing those things by ourselves, because some of these things were told about, especially about the special measures that were put in place to prevent the virus from spreading among the IDPs. It would have been better that one do an evaluation of those things by oneself. But the COVID was a restriction to that it couldn't allow for that. So that's a major implication of these findings for evaluation study, especially. So we conclude that the pandemic had adverse impact on conflict-induced IDPs in the northeastern Borno state of Nigeria. Howbeit, it had not spread among them. Yes, that's the major thing. Even though preponderance of opinions or preponderance of literature about that pandemic will usually spread faster among IDP population given their living conditions. But what we noticed, or what we found out in IDPs in Borno State, Nigeria, is that there was only, throughout the period, there was only one reported case of COVID among the IDPs. And this one case was, thankfully, was quickly noticed and taken care of, and it didn't spread. Others didn't contract it. So even though the pandemic affected the IDPs in Borno State, it affected their welfare, but then it didn't spread among the IDPs. Also, like I mentioned before, this evaluation was limited by travel restrictions to the IDP camps. Hence, of course, the pandemic constituted the major challenge to this evaluation. Okay, thank you for listening, and I welcome your comments and questions. Thank you.
Thank you very much, Harrison, for your presentation. Any question for Harrison? Any question?
I have a question for Harrison.
Okay.
Jennifer?
Yes, Jennifer.
Harrison,
please.
thank you so much for sharing the presentation. It sounds really, really fascinating. Do you have any plans for follow-up research, or either follow-up research emerging from the research that you've done now, or just research that builds on the findings? Is there anything interesting that has come up that, and let's just think big now, right? Like, let's just assume you have the funding and you can do it. But what would you like to focus on a bit more, if you could?
Okay, thank you. Really, a follow-up study would have been nice. That wouldn't have been an issue. But then we also know that the pandemic crisis has reduced, and a lot of safety protocols that were put in place before has now been relaxed. A lot of it has been relaxed, and I'm sure that if I visit the camps now, I am sure that a lot of those safety protocols that were in place then, a lot of the things we were told during the COVID will not be in place anymore. So that may be a challenge, a major challenge. It would have been best to be right on the feed at the height of the COVID. That would have made a lot of sense. But now the COVID is a lot of protocols have been relaxed, and I'm afraid that one may not really get the true sense of the situation amongst, except that we want to know if the hygiene, because frequent washing of hands, providing of water, told us were the general practice during the COVID. But one may want to also follow up if those hygiene processes are still being in place in the camp, are still being put in place in the camp. Okay, one may also want to know how much of those safety protocols are still on ground. Well, we understand that COVID has been much relaxed now, but except for that, especially for that kind of population, one may be interested to know if these measures, or how much of these measures are still in place to still guide this special population from contracting the COVID, even though it has is well relaxed now. That may be some other areas I would like to touch. Thank you, Jennifer.
Thank you, Harrison. We have another question from Mirvet. Mirvet, do you want me to read the question?
Yeah, I mean,
I can, okay.
Yeah, thank you.
Okay, I think I got it. Should I proceed? Marat? I think I got that right. I'm not sure. Okay, Marat is saying, I wonder what was the capacity of conducting the COVID tests in the camp? Do people need to travel outside the camps to do the test? During the heat of the COVID, what they were doing for them, since they weren't doing tests for the IDPs, then what they were doing was just trying to protect them to ensure that they don't come in contact with people coming from outside. In as much as they've not gone outside, they've all been confined to the camp. So there was really no point conducting COVID tests on them when they have not gone outside. So what they did was more of a proactive or a protective measure to ensure that they don't get in contact with people coming from outside, people who have been exposed to the risk of contracting the COVID outside. So it was more of a proactive and protective action they did for the IDPs. The only thing was that their health, when they fall sick, there used to be, according to what we were told, there used to be some special clinics around there that do attend to them. But during COVID, those clinics were no more. They had to be going outside of the camp, especially for those who took ill very seriously. They took them outside of the camp where they are exposed to, they are exposed to greater risk of contracting the virus. And then, of course, they also, the hospital bills are also very much there. The only time we are told that test was done was when a case was reported. A case was reported in one of the camp, in one of the largest camp, and there a case was reported among the IDPs. One was, I was wondering how the person got to contact it, but the camp officials were saying that for them, they still are not sure, very sure of how the patient contracted the virus, possibly. So what they did was not to test the entire camp because it's a huge population, I don't know. And Nigeria was struggling with testing kits at that time. You know, the whole world, the entire world was struggling for kits. So what they did was to run a test on the immediate community. You know, I said they live 6 per tent. So they run the test on the other 5 who lives on negative. They were negative. They haven't contracted the virus as of the time of that. So that was the only, and they also made sure that that patient didn't get close to any other part of the camp or get close to any other camp member. So that was the case. I hope I answered your question, Margaret.
Yeah, thank you so much. Yeah, thank you.
Thank you, Jennifer. And Mervet, for your question. Thank you, Harrison, for the presentation. Now we'll move to the last paper with Sana, Ahmed, and Aisha. The paper is Participatory Approach to Measure the Impact of Women, Economic and Political Participation in Conflict Torn in Syria.
Hi everyone, my name is Aisha Ibrahim from Syria. Today I'm going to talk about our research that we did in order to develop indicators that can be used by local organizations based on women peace security agenda. Let me share my screen, please. Can you see my screen, please?
Yes.
Yes. Yeah. Can I shut the camera, if I could? Our research name, participatory approach to measure the impact of women organizing and political participation in conflict-torn Syria. Why us? The question here, why we do this research? We are a local Syrian group that has been involved in political activity scene in Syria around justice and a mechanism for democracy's transition post-conflict. We work with a lot of feminist organizations. We promote grassroots activism, and we did this work because we work with these groups. Context, women played a major role in the period of the Syrian uprising of several economic, social, and political levels. We see that they participate in the peaceful demonstration at the beginning of the Syrian conflict. They also resorted to organize themselves within society and building a popular base for them due to the fact that their voice wasn't included in any political decision regarding Syria previously. Concentrating their presence within community organization, but despite the lack of many basic pillars, community organization are still able to operate, and despite this rate, the fears here are and restriction of the coronavirus and the return of the Syrian regime. Here we talk about WT worked with 5 women organizations to develop indicators based on the WPS global list as a basic base on which its indicators were built. The aim of developing these indicators is the possibility of using them by local organization to unify the language between them and build bridge between each other, the local organization, while being careful and don't make any change on their programs and work, so that they can measure their impact and ground easily. The work was initially to provide a series of training for partners concerned with monitoring, evaluation, setting indicators in general order. We order to achieve a unified understanding and knowledge of participants. After that, we conduct a practical exercise that include diving the participation into 4 groups, each group working on setting its own goals and indicators based on the WPS global list, Women Peace Security global list. The work was designed and implemented during the COVID-19 pandemic, where we related heavily on desk review, organizing feedback, and brainstorming. We have discussion session between working partners group. A method was partners were identified through camping exercises that was done in 1980 by Dawlati and Wilf. We have two criteria for working on the project under 5 sections. The first one, provide experience in working on topics related to gender equality and women's political participation. The second one, able to reach women from their communities. Third one, have a clear structure and management team. We make that to ensure that there are sufficient human resources within the organization, and that this work is beneficial to them. Fourth, path reference check. Also, we make that to ensure that there is no political affiliation with the organization or the extent of relation with any military faction, and don't cause any danger to other organizations. Fifth, was able to assign a focal point. Partner covered communities in Azaz, Damascus, Suwaida, and Al-Hasaka, in addition to one partner in Al-Biqa in Lebanon. Capacity building. We have 5 partners had a working relationship with Dawlati for the last 3 years on the woman organizing on gender sensitive justice in Syria. At first, we presented the project to them, and then we gave a training session on monitoring evaluation. We trained to build skills and understanding, to identify working indicators, data collection also. Technical exercise. We use the Women Peace Security Framework as a working ground to build the indicators around them. We see that most of women-led feminist organizations in Syria already use the agenda to frame their work and programming. Considered on of the main document and circulation among UN mechanism, INGOs working on women rights and participation. The WPS engages with women's rights, participation, and experience during arms conflict. The exercise focus on populating the themes, pillars of the WPN woman indicators that are within the constraints of woman-led feminist organization, resources, capacities, and operation. During during the exercise, the participants were divided into 4 working groups, each group working on a specific indicator from the global list. Review and feedback. WPS global list was designed to be used by countries and international organizations. So we see that we have to develop these indicators so that local organizations can use them and they can measure their work based on them. As we see, indicators from the working group on each themes was grouped with those of the WPN global indicators list to draft a consolidated list. The list was sent back to all the partners for a round of feedback and review. Working language was Arabic with continue translated when we need. To make ensure that concepts don't change when translated. Some of the indicators that were adapted from the original global WPS list was adapted to reflect how women-led feminist organizations and CSOs in Syria can collect the data, identify sources and of information, report of the indicators, and what context-specific information should be included. After that, we made a follow meeting to go over these questions and adapted the list. Overview. The list of indicators adapted the WBS list to be used by a woman-led feminist organization and CSOs working in Syria directly within the framework of the Women Peace Security Agenda. Our purpose was to create a common language for grassroots groups to communicate progress within localized communities, allow groups in different areas to compare and accumulate their findings across conflict lines. We saw that there is a constant challenge in terms of the availability and accessibility of national or local information system. The first one, the list contain a total of 37 indicators, qualitative indicators 27, quantitative indicators 10. How we read the list? The list have 4 main themes. Every theme have goals, between 3 or 4 goals. The goals like Anis, they have a lot of or many of indicators on it. We create the table like the first column, identify type to indicator, quantity, qualitative. How we present the indicator are report, C contact review, S survey, I information system. The second column, it was about the indicators and put it there. Third one, description, how we description the indicators. We have formula in present. Presented to provide a description of data to collect. For example, QA indicators and formula is present. Finally, we have like a in fourth column. We can here put some notice for the indicators and description, context-specific information to add, complement the indicators data. Here we have the themes. We have 4 main themes. Prevention, it has 4 goals under them and 9 indicators. The prevention theme under the programming to prevent all forms of violence against women with practical focus on prevalence of report case of SGBV and pattern, mechanism to address women's rights in early warning system and conflict prevention mechanism. The second theme, participation. Here we have 3 goals and 10 indicators. Under participation theme, we have representation and meaningful participation of women, formal and informal process, national and local government activities to prevent, manage, solve, and respond the conflict and violence of women's rights. The third theme, protection, we have 4 goals and 9 indicators. The protection theme, under this theme, we focus on protection of human physical and mental health, protection of livelihood support, access to justice from work and at risk. The final theme, relief and recovery, we have 4 goals and 9 indicators. We focus here to a degree satisfaction of human reproduction right and education need, finding on gender equality issues. Next step, what we think to the future. We are moving on this step to ensure that the indicators list are uh, fruitful for women led feminist organization and CSOs in Syria, continue to expand of each indicator through future review of related sources, data access, collection, and analysis, open the review process to other partners and group on the themes and nested indicators under them. Organize small case studies to operation as practical exercises, plus reviewing a number of ongoing program project partners group. Thank you. Thank you for listening.
Thank you very much. So thank you very much, Aisha.
Thank you. Thank you, John.
So if you have any question, please raise your hand or write in the chat box.
I have a question for Aisha.
Go ahead, Jennifer.
Aisha, you mentioned I mean, first of all, really interesting presentation, and thank you so much for sharing all of that with us. It was fascinating to listen in. And you mentioned your work with these other women-focused and feminist organizations, right? Do you also work when it comes to evaluation and when it comes to developing new approaches and participatory approaches, right, that work for the context that you work in? Do you also work with other organizations beyond these women, gender and feminist organizations?
هلا can I have a little help from my friend Ahmed to translation to me, please, Ahmed? انه في هيدي المرحله نحن اشتغلنا بس مع المنظمات النسويه حاليا لحتى نشتغل لسه كمرحله مبدئيه، بس نحن بالمستقبل ممكن انه عم نطور هيدي المؤشرات حتى تقدر المنظمات الثانيه تستفاد منها، مو بس انه هي خاصه بالمنظمات النسويه.
Actually, something. I will upload my presentation. You can speak slowly in Arabic and you will see the subtitle in English.
Sorry.
Go ahead, Ahmed.
Okay, I'm just going to translate what Aisha said. So thank you, Jeremy, for your question. So for this part, for this work that we've focused our work on working with this women-centered and feminist groups, just to build up the indicators. Yeah. Okay. Sorry, wait. Let me just put the video on. Okay. Yeah. So for this work, we focus most of our work on working with women-centered and feminist groups. We have other programs that too interact with youth-centered groups, and also some of our projects to interact with and engage with relatives of people who are detained and missing. The eventual aim of this list of indicators is to other groups to be able to use it as well, but mainly it's for groups who are working on programming related to gender equality. So I would presume it would make more sense for groups who are engaged with programming related to the WS Women, Peace and Security agenda to be making most of this most use of this list.
Thank you, Ahmed and Aisha.
Thank you too.
Any other question? Okay, I think we should stop here. Thank you again for Mervet, Jennifer, Harrison, and Aisha, and Ahmed for the presentation. And hope to see you tomorrow for our second panel with additional couple of papers on evaluation in the Global South. Thank you very much.